Okay. I don't know. The lighting's fine. It's fine. Okay. Water bottle and water bottle me. Perfect. You can close the door. I might yell for you if I need to, and then we'll clip that. Okay, bye. Okay, let's see how much we can get done. She just fell asleep. So this is the first episode, and naturally we have to start with the birth story. Eloise's birthday. Again, this is not scripted, so bear with me because the timeline is a blurry. I know if I had Andrew in the room, he would be able to piece things together a bit more for me because labor is no joke. But let me start from the top of the morning. The day is March 17th, 2026. I'm, I think, 39 weeks and 17, I'm doing the March 20th. So whatever minus 3 days is. I guess a key point to bring up, and we'll talk about it in future episodes, is we had some struggles in our fertility journey. So we ended up doing IVF. Mind you, as soon as we were discharged from the Atlantic Fertility Clinic over in Halifax at the 8-week mark, I was followed by an OB here in St. John, New Brunswick, and also followed by maternal fetal medicine. So frequent ultrasounds, which was really nice. My pregnancy was great. I wasn't considered high risk throughout. So low-key, my OB kept forgetting that we were an IVF pregnancy. So towards the end, I'd say around 37 weeks, as we got closer to the 40-week mark, I asked her, I'm like, is there any rule of thumb about inducing IVF pregnancies? Usually I think that's due to maternal age, and I'm not that old, although tomorrow is my 34th birthday while recording this. So she said, ooh, let me think about that. And then at the 38-week appointment, she said, you know what? We're going to induce you on paper the day before your due date. So my induction was scheduled March 19th and my due date being March 20th. She didn't really elaborate on what the induction entailed, like whether it be like mechanical with a Foley catheter or misoprostol, a ripening agent for your cervix. So I was just kind of like going with the flow. She books a sweep 2 days prior to any induction. So I had a membrane sweep booked March 17th. And for those of you who don't know what a membrane sweep is, they're literally going up through your cervix and looking to pop the membrane so that gravity works. I don't know. I actually know how it works. Google it. Membrane sweep. So St. Patty's Day, I wake up, third trimester, the entire third trimester, I literally couldn't control my bladder and or bowels. She was burrowing into my cervix / vagine. I swear she was trying to escape. So I woke up every couple hours and then I felt like I was going to piss my pants or piss the bed, and it would literally just dribble out. Anyways, I'm up at 5 a.m. on St. Patty's Day to go pee, and then I go back to bed and insomnia. So I'm like, oh, classic. Well, at least my appointment's at 10 a.m. I have time to wake up. I'm going to go take a shower. I'm going to make myself a nice breakfast, and then we'll go to our appointment at 10, which is the ultrasound, and then we go downstairs for the membrane sweep at 10:30. My OB did tell me to bring a book or a Kobo because she was assisting in the OR that day, so she wasn't really sure of the timeline. But neither here nor there. It's going to be a great day. Anyways, Andrew, my husband, starts stirring around 6 a.m. and I'm like, ooh, sweep day. This is so exciting. And the power goes out. And I'm like, what the hell? The only reason why we notice is I think his phone nearly blew up, and we started like practicing with her sound machine and clock in our room. And that just went out and I was like, oh my gosh. And the worst part is we don't have service in our home, which is hilarious. We rely on Wi-Fi calling and our Wi-Fi. So we don't have Wi-Fi, can't contact anybody. And we're on well. So the toilets don't flush. And like I just said, I can't control my bowels. Am I going to have my morning poop in a toilet that doesn't flush? And no, we did not prepare for this wind rainstorm and fill the bathtub with water. So I'm oddly calm for what's about to happen. But I talk to Andrew. I'm like, should we go to a cafe until our appointment? Your eyes are supposed to be closed. Should we go to a cafe or like what should we do? We literally have time to kill, and I'm not showered. Poor OB, literally going to go down there when I'm not showered. Also, I think I should have started this episode and said like a bit of TMI coming your way, but I think that's going to be in all episodes. So we end up leaving the house at 7:45, across basically down the street from the St. John Regional Hospital, and they're already bumping St. Patty's Day music, which was a vibe. And I got a really nice eggs Benny. Yes, I did the runny yolk YOLO. I'm about to have a baby. I'm fine. Because apparently you're not supposed to, salmonella or whatever. So delicious breakfast. We end up leaving Brits around, I want to say 8:45. We get to the hospital. We didn't know what the registration was going to be like. So we registered and we still have an hour to kill. So we go up and sit and I read. And of note, which was really cool. And I don't know if any of you guys are witchy, but my registration number was B444. So I was like, ooh, this is kind of witchy, and a little angel number. And I didn't look it up yet, but I took a picture of it. So we read for a bit and then we went to the ultrasound. All the ultrasounds leading up to this day, like she was literally looking great. She was practicing her breathing, hiccuping, check, 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 check. So the nurse, after we finished the ultrasound, she goes, good luck. Maybe you'll meet your baby today. And I was like, why? Why do you say that? And she goes, your OB is very effective. And I was like, that's fun. And then in the back of my head, I'm like, we don't have our bags in our car. They were all packed at the front door. Everything was packed. Colostrum that was collected in the freezer, bags by the door. We just didn't put it in the car. Was it because we didn't have power? Was it because I forgot? We don't know. Anyways, so we go downstairs, and lucky for us, our OB is ready for the sweep. So I go into the room, and Andrew's coming in with me. She kind of like, there's like a curtain that she closes for like modesty, mind you. Like we've literally been through so many vagine checks and everything. There is no modesty with pregnancy and birth, by the way. So get that out of your head. Anyway, she has to do a cervix check. All cervix checks leading up to today, March 17th, I had been like 1 centimeter dilated and 30% effaced. So again, not a medical professional, but from what I understand and what I read, there are 3 different kind of key markers that they look for when you're ready to have your baby and when you're going into labor. So they want you to be dilated in some capacity, 1 to 10 centimeters. Effacement is the thickness of your cervix. So the thinner your cervix is, the easier it is for the baby to come out. And then station, so how far down the baby is into your pelvis. She had always been pretty far down. I would say like -2, -3, because it's +3, +2, +1, 0, -1, -2, -3. So she's always been really low, which is why I couldn't control my bladder. But modestly effaced, modestly dilated. So she did the check. So that was up until today. Today, the 17th, I'm 2 centimeters dilated, 60% effaced. I can't remember. Anyways, progress, which is great because what we're doing today is a sweep. And then Thursday, the 19th, we were going to have the induction. So she goes, did you want Andrew to hold your hand during the sweep? Like it's going to be a little uncomfortable. And I said, yeah, for sure. So Andrew's literally about to get up out of his chair. And she goes, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. I kid you not. I'm laying there violated. I'm like, oh, he didn't even get a chance to hold my hand. And she goes, that was great. Normally I have 1 finger in and I had 3. And I was like, I could feel it in my throat. That's how aggressive it was. Mind you, it lasts 10 seconds, just like aggressive 10 seconds. she sits me up on the bed and she goes, okay, so now you are going to go home and have sex tonight and have sex tomorrow. And I'm looking at Andrew. I was like, I'm not doing any of that. But I guess semen can help ripen the cervix, but like gross. And then she says the goal for Thursday, labor and delivery is going to call me to tell me to come in, and they're going to administer misoprostol, which is a ripening agent, and they're going to send me home to take potentially 4 doses on my own. It's an oral medication that you can take every 4 hours. So they want me to, because I've already had a bit of progress, to go home and labor on my own. Other methods can be introduced if needed. So I was like, okay, that's a great plan. So she hands me a pad and she goes, okay, I'll see you Thursday. And I was like, okay, bye. So I stand up and I put the pad on and I look back on the bed and there's like some brown blood. I'm like, of course, you literally just like went up there. I stand up and I have the pad on, put my pants on. And I'm like, oh my God, Andrew, is that blood? So I take my pants down. My water broke. So I took the pad off and I said, give me another pad. So I get another pad, put it on again, and it's coming out in like it's not the dramatic, like everything's out at once. I think of her head as like a little stopper, like clogging the drain. So every time she'd shift or I would shift, a little bit would come out. I soaked through, and I'm telling you, these night pads, thick, 3 pads in like 2 minutes. And then I was like, Andrew, should you go up to the hall and like maybe get someone? And as he's doing that, I grab the garbage can and I'm like straddling the garbage can. And one of the nurses comes in and I go, this is not piss. And then they start laughing and then they run and get my OB. And she comes in, she goes, that wasn't supposed to happen. And I said, are we alarmed? Like, what was supposed to happen? She goes, no, it's fine. You're probably going to go up to labor and delivery right now. And I was like, okay. She goes, I don't want to make you worry, but it's very busy up there. And that's not going through my head at all. What's going through my head is my water just broke. I'm literally leaking. How am I going to get from point A to point B without continuing to leak? So she basically says that I'm going to go up to labor and delivery. We're going to see if they have the capacity to keep me, or are we going to basically expedite that plan that was on Thursday and send me home for 12 hours? Because once your water breaks, there's risk of infection. So they want to mitigate that risk. But the OB that's upstairs on call will determine if I stay in the hospital or not. So I'm just like over a garbage can. There's like this weird blanket. Andrew goes and gets a wheelchair and I'm just like put the blanket on underneath, and he bounces me off a couple doors because we don't know the dimensions of this wheelchair. And off I go up to labor and delivery. And we're just like, what the hell is happening? Which is the theme for the entire day. So during our pregnancy, and I think it's just changed for COVID, you don't get a tour of what labor and delivery looks like. We had these Horizon Health prenatal classes, and they show like a very outdated video, but like I've never been upstairs. You have to ring a doorbell. It's on the 3rd floor. You ring a doorbell, they let you in, and then Andrew just rolls me in. We go to the front desk. We're like, hello, Emily Martin? And they're like, oh yes, your OB just called up. So they had a room ready. Again, we roll into this room. I don't know if I'm staying for them to check to make sure it was amniotic fluid. It was, because again, you know how you can like stop your pee stream? You can't do that with this. So I thought they were going to test that, give me some meds and send me home. They give me a Johnny gown or whatever gown and these one size fits all mesh underwear. Ladies, I'm telling you, these are not one size fits all. So do not be alarmed when you pull them up and they don't make it over half your ass crack, because Andrew was laughing at me. So they gave me these mesh underwear and a pad to put on because, again, I'm leaking and that's what you have to wear, and a Johnny shirt. And I get introduced to a couple different nurses. Again, they're so busy on this floor. I don't know what everyone was doing having a baby this week, but usually you should get one-on-one care in this unit, but they had to have nurses share me, which I didn't really care because I was like, I don't know what's going on. Am I having the baby today? Is it tomorrow? I don't know. I also want to note that I didn't really have a birth plan. I know a lot of people go in with expectations. And I think it was because of the way we conceived and how I really didn't control or couldn't control anything that happened there, that my expectation going into having a baby was make sure she's safe, make sure I'm safe, and that's it. I was prepared for a vaginal delivery. I was mentally prepared for C-section if I needed. I was prepared for an induction. Again, educate yourself on all, and this is what I did too. I read, educate yourself on all outcomes. And I think this is what helped I've generalized anxiety, but like know the outcomes, and then it's just, what happens is going to happen. You can't control this. So I'm in the room. The OB on call comes in and goes, okay, so we're going to give you misoprostol. And I was like, oh, perfect. I'm already like, she already told me that that's what's going to happen. And then I was like, am I staying or am I going home? And then she goes, you're staying. So I'm having the baby in the next 2 days, potentially. So basically they gave me the oral meds. I'm sitting on the bed. And then I looked to Andrew and I said, because this is now probably close to noon and I'm hungry now. The eggs Benny didn't really hold me over. He now has, oh, my voice crack. He now has enough time to go home, get all of our bags, and then stop at Zesty Lemon, shout out, and get a nice soup and sandwich for us to eat, because I have 4 hours. I can keep eating until they tell me I can stop. So 4 hours until the next dosage. The expectations of what's going to happen is they said I'm going to have some period cramps. So yeah, those are my expectations. But they said to keep moving. So he's gone for about an hour. I'm just chilling. I went to pee, because in your room you have your own room and then your own washroom, which is key because it's aggressive in there. So I went pee. I'm reading my Kobo. Life is good. Andrew comes back. I'm just gonna pause here. Andrew. Okay, back to Zesty Lemon. Delicious sandwich. Didn't eat my soup. Regret. I'm starting to get kind of crampy. And when I say crampy, like a really bad period, which is manageable. Like I'm able to walk around. But at this point, I'm like, okay, because I had been to pelvic floor therapy, which will be discussed in a different episode. 10 out of 10, 20 out of 10 recommend looking into that like during your pregnancy, to start postpartum too, to continue postpartum, start at pregnancy. I wanted a ball. I wanted a peanut ball, and I wanted like one of those big balls. I wanted to keep moving as much as I could because motion is lotion, as my chiropractor husband would say. But moving around, like as soon as you get stagnant, you tighten up. So period cramps. Braxton Hicks, they say they're practice contractions, and I get it now. So all throughout the 3rd trimester, I had Braxton Hicks, which was just like your belly just feels tight and you're like, oh, it's tight. Doesn't hurt. Contractions. So I'm now starting to feel contractions, and I'm getting back labor contractions. So it starts in my low back, wraps around to my pelvis like a period cramp, and then my stomach gets really tight. And I look at Andrew, I'm like, oh shit, this is a contraction. Mild, but I'm starting to get uncomfortable. And then I start to get nauseous. So we're close to 4 p.m. now, and I'm getting pretty nauseous. I also have to poop, and I haven't pooped in a bit. So I'm uncomfortable. We haven't seen the nurse in a bit because, again, they're bouncing between other rooms. So I'm like, Andrew, can you follow me? Like this, guys, it gets very vulnerable. I'm like, will you come to the bathroom with me? I need to go poop between contractions. I'm standing over the toilet between contractions, trying to sit down. I can't even sit down. And then I'm like, grab the bucket. And I puke into the bucket. And then I looked at him and I was like, that gave me relief. And then I didn't have to poop again for that moment. And then the nurse pops her head in. She goes, how are you making out? I'm definitely in pain and I'm feeling very nauseous. And she goes, okay, let's do a check to see where you're at. And we'll chat with the OB to see if we're going to do the 2nd dose of misoprostol. I hope I'm saying that right. Misoprostol, or if we go on to something else. So she does a check, and I'm now 3.5 centimeters dilated and over 60% effaced. So my body's working. The misoprostol's working. She leaves the room and then comes back and she says that we're going to stop the ripening and we're going to labor nap. We're moving. We're moving and grooving now. But what we're going to do now is morphine and Gravol. And it's an injection into my bum. And I'm like, let's do this. I need some relief. The morphine, guys, love it. Loved it. Gave me immediate tolerable relief. You still feel the contractions, but I'm like, oh, this feels good. And it gave you a little buzz too, which was fun. Intermission. I think she's pooping. Anyways, and then the Gravol kicked in really nicely too. So that nausea that I had, well, it alleviated a bit after I puked, but felt way better. So the morphine and Gravol you can get every 3 hours. So now we're coasting for another couple hours. Just 1 second. Let's wait for the now. Okay, so a couple hours. I'm sitting on the ball, I'm walking around. I think I'm starting to get really uncomfortable, like very uncomfortable. And with this nurse, I think we're at like 5 p.m. Shift change is around 7:30. And they tell me this. And they say, hopefully at shift change, someone has a baby and gets discharged so that I can have one-on-one care. Because another key thing too, for an epidural, you need one-on-one care. And this is something I forgot about until literally 2 days ago. And I'm 4 weeks postpartum. So this just goes to show some things you literally black out. Like I can't remember some conversations because I was like delirious. So my nurse, Sweetie Pie, she comes in and I'm like, let's get the paperwork started for the epidural because again, shift change at 7. After 4 p.m., you don't have an on-call anesthesiologist in that unit. You're reliant on the anesthesia that's on call for the entire hospital, which they could be in the OR. So she's like, okay, I'm going to get the paperwork started after this morphine. If we need to jump to fentanyl, that's what we're going to do. And I said, okay. I'm like, I'm uncomfortable now. The fan we brought, we didn't charge, but luckily there's a big fan in the corner. Get a fan. I'm like a dog. When I'm feeling nauseous or uncomfortable, I'm like a dog and stick my head out the car window. That's the vibe I was giving. I was laying on the bed. Andrew was giving me sips of water and I had the fan like blasting on my face. Shift change, new nurse. Again, I can't remember their names and I feel very bad because they were very sweet. How you feeling? Not good. Where's the epidural? And then she said, okay, we're almost due for fentanyl, which you can get every half hour, which is great because then we can stop it in epidural, blah, 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 blah. So she gives me the first dose of fentanyl in an IV and I have flashbacks to my egg retrieval and IVF, which you are administered fentanyl. Didn't work, which I will tell you about in another episode. So in the back of my head, I'm like, this isn't going to be good. And then I'm also like, what's the status on the epidural? And she goes, I've got some bad news. And I was like, okay. And she says, Doctor blah blah blah. I'm not taking any of the doctors' names just for like their privacy, but if you want to message me, I'll tell you who they are. He's in the OR, and I didn't really tell them what I did for a living, but like I'm a rep and I work in the OR, so I kind of understand the concept. And I was like, "How long's the case?" And she's like, "He's going to be 2 hours." And in my head, I'm like, "That's bullshit," because it takes about 45 minutes to put a patient to sleep, and 45 minutes to wake them up, bring them to recovery, give or take a few. What kind of case is he doing? Someone's lying to someone, and you're definitely lying to me. So she gives me the fentanyl, not working, really uncomfortable. I'm past the point of moaning, and I'm now like, I've never sworn so much in my life. Andrew is so calm, which I hope that your support person is calm because you are going to be a different human. Like I was seeing sounds kind of vibe. Contractions suck. They suck. So first dose, and then it's a new OB that comes in too. So the nurse does a check. Guess where I'm at now? And this is, I want to say I would say 9:45, 10 p.m. 7.5 centimeters, 100% effaced. We're getting close. And I'm probably due for my next fentanyl, which I don't give a shit. It's not working, in like a couple minutes. She goes and gets the OB that's going to deliver this baby. And he comes in with a first year resident, which she was very sweet. And he introduces himself. I don't remember the conversation because I'm so uncomfortable. Also, backtrack. Did I spend time on that ball? Absolutely not. Was I in the bed? Yes, I was. Do I regret it? No, because I couldn't do anything but side lie. It's like, when you're so big and pregnant, you can't lie on your back because you're uncomfortable. I could only be on my side whimpering. So I asked him, I was like, where's the epidural? And he's like, the doctor's still in the OR. And I'm like, oh God. And then he goes, but let's check. Maybe he'll be done soon and then they can come up. He does the check and he goes, I go like this. I don't know what he's doing down there. Well, you're 10 centimeters and you're having this baby without an epidural and we're doing it right now. And I don't even know how I would love to hear what Andrew says because I think I blocked out. I hold on to these bars on the bed and I'm like, holy F word. Am I allowed to swear on Spotify? I don't know. This is happening. And then my life flashes before my eyes and I see them hustling and bustling at the end of the bed because they need to create a sterile environment, scrub up and all that. And I see a new face come in. She's the baby nurse. It's all happening at warp speed. I'm like, what the hell? And they've been off and on monitoring the baby. So they have these like monitors, early labor, they have them strapped onto you. Now she's just like placing here and there. So nurse on right side, Andrew on left side, me panicking. And I'm like, your body, I don't know if anybody's going to relate to this, but in pregnancy, you get constipated and you may or may not develop hemorrhoids too. But when you're constipated, you bear down quite a bit. So when I say I knew I was going to be an expert at pushing, I knew what to do. But your body, like involuntarily, like you feel like you're bearing down and you're not actively pushing. So I remember saying, I have to poop. And then they go, like, everyone looked at each other because they were like, oh, it's time to go. Oh gosh. Okay, we're almost done. So she's ready to come. They walked me through how to breathe, which was interesting because like I never learned that either. I probably should have looked it up. So you do one really big cleansing breath, and then you're going to do 3 separate 10-second pushes. So cleansing breath, no problem. I knew how to do that. My first push, the doctor stopped me because I did like that guttural yell, and he stopped me and goes, no, you can't do that. And I'm like, I don't know what I'm doing. And he's like, you need to internalize it and push. I'm like, what the fuck? So you do the cleansing breath, and then you go and like literally bear down for 10 seconds and then rapid fire do it 2 more times. This was the most out of body experience ever. No epidural. I'm like full on animal mode right now. We do a couple rounds of this, and then at one point the OB is like, Emily, I don't want to alarm you, but the baby's heart rate is decreasing. When I tell you, I grabbed the back of my legs and was like, and pushed so hard. Anyways, biggest shot I ever shot. This little lady entered the world. The ring of fire is true when her head's just passing through. Also, Andrew didn't want to look at all, and he watched the entire thing and said to me afterwards, I couldn't look away. It was like a car crash. So once you get her head out, the rest of the body is easy peasy. And I just remember going, it like, they flop a purple baby on your chest, and you're just like, what just happened? The adrenaline, it was so messed up, but so cool, but so messed up, very messed up. Purple baby on my chest. They tell you that you're going to have so many hands checking the baby. You're just kind of in like shock, basically. Andrew's crying. I didn't cry because of shock. Andrew was crying, let that be known. They take her away briefly to measure her, and then they put her back on my chest. The doctor's also telling me to push again for the placenta to be delivered. I'm like, leave me alone. The placenta was no issue, gone. And then the babies do this weird gremlin crawl to latch onto your boob for the first time ever. I laughed at that. That was like kind of what she's doing right now. It was crazy. You get this really nice 1 hour of skin to skin with your baby. Are you getting fussy? Are you still sleeping or are you fussy? Okay, we're almost done. This is a good story. It's your birth story. So I get a really nice 1 hour skin to skin. During this time, they tell me I have a 2nd degree tear. They stitched me up. They froze me, thank God. But like, I don't even care about that at this point. Oh, Andrew, do you want to come get her? She's pooping in my hand, I think. I'm pretty sure it's poop. It could also be just toots, but she's squirming and worming. Yeah.
Come here, Poopy.
She's kind of distracting me a little. I think I missed key points, but we'll have to watch this back. Maybe we have to read.
Come here, Poopy.
Ugh.
I know. Bye.
Bye. Okay, so that hurt my toe. They stitched me up. I had my 1 hour skin to skin. Again, all of this is such a blur because I literally just gave birth, which is crazy, and also without an epidural, and I did it, and I survived. They hand the baby over to partner, dad, Andrew, at this point, for skin to skin, and the nurse goes, okay, time to shower. And I'm like, what the hell? So they give me like a towel to put on my crown. I waddle over to the bathroom. She turns it on for me. And I'm like, what's happening? And I shower, which kind of felt nice, I guess, because I got a little sweaty. And then when I finish my shower, I look down, blood is pooling. The nurse comes back in and I look at her, I'm like, you're so vulnerable, you're naked, this person. I was like, is this normal? And she's like, oh yeah, I'll sponge it off you after. You take a seat. And I'm like, sit. How do I sit? So I sit down in the chair next to the shower, I guess. And she makes my first diaper for me. And we're going to talk about an episode down the road for vaginal delivery aftercare. And I'm pretty confident that I perfected the regime. So tune into that one when it's launched. But she makes my first diaper for me, which is those one size fits all underwear. And then she lines a couple pads and that's supposed to be enough. Anyways, so she does that, puts another clean Johnny shirt on me and sits me in a wheelchair. And Andrew's shirtless holding this fresh baby that we now have. And she looks at us and she goes, you ready to go? And I'm like, where are we going? And she goes, you're going to the postpartum unit. And I look at Andrew and she's like, oh, he can pack up all your stuff. And I'm like, well, I'd like for him to come with us. Like, it's now close to 2 a.m. Oh, by the way, she was born at 10:48 p.m. St. Patty's Day baby, which is pretty cool. So like all of this now brings us to almost 2 a.m. So yeah, we get wheeled down the hallway. I'm holding this baby and Andrew's lugging the suitcases and we go to the postpartum unit, which is going to be an interesting episode. Let's just say that. So yeah, that's my birth story. It took me a few days. I feel like when it was fresh, I was a bit more dramatic about it, but everyone gives birth. People give birth every day and it's doable. It's painful. It's messed up. Can be traumatic. Of course, people have traumatic experiences, but our bodies are made to do it. And with the tear, with the lack of epidural, I will do it all again for that cutie patootie baby. However, I would love an epidural. That would be really nice. It would be nice to have like a chill environment. But that is episode number 1. Episode number 2, I'm going to backtrack and go back to our IVF journey to give you a little bit of a sneak peek of what that looks like, what the workup looks like, and what the process looks like. I know a lot of people don't necessarily always feel comfortable sharing that part of their journey or IVF in general. But it's something that I had a really, she's crying. I had a really great experience with the clinic. So I do want to share, if anybody has any questions about this episode, about the birth, I can speak to St. John Regional Hospital and my experience only. And then, of course, every episode down the road, if you have any comments or want to message us directly, we'd love to chat. But thanks for yapping with us.